everyone, welcome to TryRight. This is Pack 365, myself Srija. So today in this session you are going to learn about what is current procedural terminology coding. So what is CPT coding? And this is the professional edition of CPT coding. So first of all, what is CPT? So CPT stands for current procedural terminology. So it is a set of codes or numbers which is used in healthcare to describe what service or procedure a doctor or healthcare provider perform. So these services can be medical, for example for office visit, surgical, example for removal of appendix, diagnostic, example X-ray, blood test. So in simple words, CPT's codes tell what was done to the patient. So who created CPT? So CPT codes are created and maintained by the American Medical Association AMA. So they were first introduced in the year 1966. So these codes are mainly used for billing, reimbursement, reporting and documentation. So medical reporting as well as proper documentation. So ICD-10 tells why the patient came, diagnosis, and CPT tells so what service was given, that is procedure. So what is the purpose of CPT coding? Why CPT is important? First is for clear communication. So CPT codes provide a common language for doctors, hospitals, coders and insurance companies. So everyone understands the same procedure using one code. For example, instead of writing a blood test, a CPT code clearly specifies which blood test. And second purpose is accurate insurance claims. So insurance companies use CPT codes to decide whether a service is covered or to decide how much money to pay. So current CPT coding helps to avoid claim denials and also payment delays. And third purpose is to standardize medical documentation. So CPT ensures uniform records across hospitals and clinics. So it also helps to maintain legal and professional medical records. And the fourth purpose is to track healthcare utilization and outcomes. So CPT codes, they help to track how often procedures are done. So which treatments are commonly used and how it is useful for hospitals and government health programs. So the fifth purpose is to support medical research and healthcare statistics. So CPT data, it is used for medical research, used for health statistics and also policy planning. So it also helps to improve the quality of the healthcare services. So CPT codes, they are usually 5-digit numeric codes. So next is what is the purpose of CPT coding? So it describes the services and procedures. So CPT codes, they explain what service or what procedure a doctor or healthcare provider perform. So instead of long sentences, one CPT code clearly represents one service. For example, an office visit, X-ray, blood test or surgery. So each have a specific CPT code. And to ensure uniform communication among providers, payers and patients. So CPT codes create uniform, same communication between doctors, hospitals, insurance companies, patients. So everyone understands the service using the same code, reducing the confusion. And also it helps to support accurate billing and reimbursement. So insurance companies use CPT codes to process the claims, to decide how much to pay the provider. So correct CPT coding gives correct payment, wrong CPT coding gives claim denial or reduced payment. So now what is the structure of CPT code? So CPT code, it is a 5-digit numeric code. So most CPT codes contain 5 digits only. For example, 99213. So this is an E&M code which represents office or outpatient visit for an established patient. So each code represents one specific service. So every CPT code stands for one exact medical service or procedure. No guessing. So each code has a defined meaning. And modifiers. So some codes may include modifiers. So some CPT needs modifiers. So modifiers are nothing but they are the 2-digit numbers or letters. So they always give the additional details about the service. Now what is the example? Same procedure done on both sides of the body and service was more complex than usual. So in these cases you have to give the additional modifiers. And there are categories of CPT codes. So category 1 CPT codes. So most commonly used CPT codes are category 1 codes. So this describe the procedures and services that are widely accepted, regularly performed in hospitals and clinics. So they are used daily for billing and insurance claims. So what are the examples of category 1? Office visits, lab tests, x-rays and surgeries. So CPT category 1 codes, they are divided into 6 main sections based upon the type of service provided. The first section is evaluation and management, E&M. So this is used for doctor-patient visits. It includes office visits, hospital visits and emergency room visits. And second section is anesthesia. So anesthesia, it is used for anesthesia services which is given during surgery or procedures. So this includes the general anesthesia, regional anesthesia and local anesthesia in some cases. And third section is surgery. So surgery it is used for operative procedures. So surgery it is the largest section of CPT codes. It includes minor surgeries as well as major surgeries. And this surgery section is further divided by the body system. And the fourth section is radiology. So radiology, it is used for imaging services. So this includes X-rays, CT scans, MRI and ultrasound. So it often includes two parts, one for technical component, one for professional component. And the fifth section is pathology and laboratory. So this is used for lab test as well as specimen examination. So this include blood test, urine test, biopsy examination and many more. And the last section is medicine. So medicine it covers non-surgical medical services. So it includes immunizations, physical therapy, cardiology procedures, for example ECG and stress test, and also dialysis. So this is about the category 1 CPT codes. And coming to category 2 CPT codes, these are the optional codes. So these are used for quality reporting as well as performance measurement. So they do not affect the payment. So category 2 codes, they help to track how well the care is provided and how the patient outcomes are there. So what is the format of category 2 codes? Alphanumeric. So they always ends with the letter F. For example, 3008F. So this is for body mass index documented. So category 2 codes, they are used to measure the quality of care but not for billing. And category 3 codes. So category 3 CPT codes, these are the temporary codes. So they are always used for new experimental and emerging technologies and procedures. So these codes, they helps to collect the data before becoming a regular code. And the format is alphanumeric, which ends with the T. For example, 0058T. So category 3 codes, these are for new procedures still under study. And CPT code sections. So CPT codes, these are organized into 6 main sections. So each section covers a specific type of healthcare service and has a defined code range. So the first is evaluation and management. So the code range is 99202 to 99499 series. So what are E&M series services? So these are used to report the patient visits. So they always focus upon the patient history, physical examination and medical decision making. So these codes, they describe the thinking and decision making work of the doctor but not the procedures. Next is anesthesia. So the code range is 00100 to 01999. So what is anesthesia coding? So this is used to report the services related to giving the anesthesia. So anesthesia makes the patient to sleep, to feel no pain and to stay comfortable during the procedures. Third section is surgery. So surgery code ranges from 10004 to 60009. So what it includes? All the operative procedures, and surgery is the largest CPT section. So it is divided by body systems. It also includes the minor surgery and also major surgery. Radiology, the code range is 70010 to 79999. So it includes all the medical imaging services. Medicine, the code ranges are from 90281 to 99607. So this includes non-surgical medical services, for example, like vaccinations, physical therapy, dialysis, and cardiology tests like ECG. So anesthesia. So what does anesthesia coding include? So anesthesia CPT codes, they cover all the work done by the anesthesia provider, such as pre-operative evaluation, checking the patient before the surgery, administrative of the anesthesia, giving anesthesia to make the patient pain-free, and monitoring during the procedure, like checking the vital signs like heart rate, blood pressure, oxygen, temperature, and also the post-anesthesia care. So observing the patient after surgery until the recovery. So anesthesia code includes before, during, and after the anesthesia care. So next is surgery section 10004 to 6009. So what is surgery coding? So surgery coding, it is a major and very important section of CPT. So this is used to report operative procedures, invasive procedures, endoscopic procedures. So these are all performed by physicians and other qualified healthcare professionals. For example, like removal of a tumor, repair of a fracture, and laparoscopic procedures. So now why is this surgery section important? Because it contains the largest number of CPT codes, and the surgery section codes, these are most complex and they are frequently tested section in the medical coding. So the surgery coding, it requires careful reading of the operative reports, as well as you have to be thorough of knowledge of the anatomy. So if a procedure cuts, repairs, removes or inserts, so it is usually falls under the surgery codes. And there are main divisions of surgery section. So the first is integumentary section. The code range is 10004 to 19499, which is also called as 10K series. So it is related to skin, hair, nails and subcutaneous tissue. For example, like wound repair, skin biopsy and removal of cyst or lesion. The second system is musculoskeletal system. The code ranges are 20,000 to 29,999. So it is called as 20K series, and this musculoskeletal system, it is related to bones, muscles, joints, ligaments and tendons. So there are examples like fracture repair, joint replacement and tendon repair. So the third body system is respiratory system. Code ranges are from 30,000 to 32,999. So it is called as 30K series. So these are related to lungs and breathing passages. For example, like bronchoscopy, lung biopsy and tracheostomy. The fourth is cardiovascular system. 33,010 to 37,799 series. So this is related to heart and blood vessels. Example like cardiac catheterization, pacemaker insertion and vascular surgery. The fifth section is hemic and lymphatic system. 38,100 to 38,999. So this is related to blood and lymph system. Examples splenectomy, lymph node biopsy and bone marrow procedures. And sixth system is mediastinum and diaphragm. 39,000 to 39,599. So this covers the surgery of mediastinum, the area between the lungs containing heart, esophagus and major vessels. So it also covers the surgery of diaphragm, which is the muscle that helps in breathing. So examples like repair of diaphragm, mediastinal mass removal falls under the surgeries of mediastinum and diaphragm. So surgery is done always in the central chest area. So seventh system is digestive system, 40,000 series. Code ranges are from 40,490 to 49,399. So this covers the organs which are involved in the digestion. So it includes the esophagus, stomach, intestines, liver, gallbladder and pancreas. So examples like endoscopy, appendectomy and gallbladder removal. Next is urinary system, 50,010 to 53,899 series. So it covers the organs involved in urine formation as well as excretion. So this includes kidneys, ureters, bladder and urethra. So examples like kidney stone removal, bladder surgery, catheter procedures are performed under urinary system surgeries. Ninth is male genital system, 54,000 to 55,899 code range. So it covers all the male reproductive organs. It includes penis, testes, prostate, scrotum, and it also involves the prostate surgery, vasectomy and testicular procedures. 10th is female genital system, 55,920 to 59,899 code series. So this covers the female reproductive organs. So it includes uterus, ovaries, fallopian tube, cervix as well as vagina. 11th is maternity care and delivery. So it covers the pregnancy related services. It includes prenatal care, vaginal delivery, cesarean section as well as the postpartum care. So these codes they are often include global maternity care before, during and after delivery. And next is endocrine system, 60,000 series, 60,000 to 60,699. So endocrine system, it covers the glands that produces the hormones. So it includes the thyroid, parathyroid and adrenal glands. Example of the procedures done under endocrine system is thyroidectomy and parathyroid surgery. 13th is nervous system, 61,000 to 64,999. So nervous system, it always covers brain, spinal cord and nerves. So the examples of the procedures are brain surgery, spinal procedures and the nerve repair. 14th is eye and ocular and nexa, 65,091 to 68,899. So it covers the eye and surrounding structures. So it includes eyelids, lacrimal system and orbit. So examples of the procedures are cataract surgery and eyelid repair. So next is 15 auditory system, 69,000 to 69,990. So it covers ear related surgeries. It includes external ear, middle ear, inner ear. So examples of the procedures are tympanoplasty and ear tube insertion. So next is radiology section. So radiology, the CPT code range is 70,000 series. So 70,010 to 79,999. So what is radiology coding? So radiology, it is used to report the diagnostic imaging and radiological procedures. So it helps the doctors to see inside the body to diagnose the disease, monitor the injuries and to plan the treatment. So it includes X-rays, CT scans, MRI, ultrasound and also fluoroscopy. So radiology codes these are used for medical imaging test. So next coming to next session, pathology and laboratory, 80,000 series. So CPT code range is from 80,047 to 89,398. So what is pathology and laboratory coding? So this section of CPT, it is used to report the laboratory test and pathology services. So these services, they help to diagnose the disease, monitor the patient conditions and to prevent the disease. So what do these services analyze? So they analyze blood, urine, tissue samples and other body specimens. So the services, they are usually not done directly on the patient. So the work is done on specimens in the laboratory. Examples like blood sugar test, complete blood count CBC, biopsy examination and urine analysis. So pathology and laboratory codes, they are used for testing body samples to find the disease. So next session is medicine section. So CPT code range from 90,281 to 99,607. So what is medicine section? So this is used to report a wide range of non-surgical medical services. So these are provided by doctors and other healthcare professionals. So these services are diagnostic, finding disease, therapeutic, treating disease, and preventive, that is preventing disease. So what is not included in this medicine section? No operations or no surgeries. So there will be no cutting or invasive procedures. So examples are immunizations, that is vaccines, physical therapy, dialysis, cardiology test, ECG or stress test, and also allergy testing. So medicine codes, they are for medical treatments and tests that do not involve the surgery. So these are the main sections of CPT coding. So next coming to appendixes. So CPT appendixes. What are CPT appendixes? So these are the reference sections found at the end of the CPT code book. So they always provide the extra explanation, guidelines and clarifications. So are appendixes used for billing? No. But these appendixes do not report services directly. Then why are they important? So they help in choosing the correct CPT code. So these appendixes, they ensure to accurate coding, to legal and complaint coding, to fewer billing errors. So appendixes, they are helping tools that guide coders to code correctly. So there are different appendixes. So Appendix A, it contains modifiers. So Appendix A, it is a list and explanation of all the CPT modifiers. For example, 26, 50, 51 and 59. So this appendix A, it tells why and when to use a modifier. So this is very important for correct billing and also reimbursement. For example, modifier 26 is for professional component only. So coming to appendix B, summary of additions, deletions and revisions. So this shows what changed from last year. So it helps the coders to stay up to date and it is useful for exams as well as audits. So which CPT codes are new and deleted this year? So Appendix C, it contains of clinical examples. So it gives real life clinical scenarios. It helps beginners to understand how a code is used in the practice. So this is best for students who struggle with the theory. And Appendix D, it consists of summary of CPT add-on codes. So there will be a list of add-on codes in Appendix D. So add-on codes, what they do, they cannot be built alone. They must be used with a primary code. So usually they are not reduced. For example, plus 99, 199 for hypothetical code. And Appendix E. So it consists of summary of CPT codes exempt from modifier 51. So modifier 51 is nothing but a multiple procedures. So some codes are exempt. What does it mean? There is no payment reduction and modifier 51 is not required for such codes. So those codes are listed under Appendix E. So always check this Appendix E before applying modifier 51. And next is Appendix F. Summary of CPT codes exempt from modifier 63. So modifier 63 means procedure which is performed on infants less than 4 kg. So this appendix lists codes where modifier 63 should not be used. Appendix G. Summary of CPT codes that include moderate or conscious sedation. So these are the list procedures where sedation is already included. You should not bill sedation separately. So it prevents overcoding. Appendix H. Alphabetical clinical topics listing. So it is also called as alphabetical listing. So it helps you to find related codes by clinical topic. So this is useful when you know the condition but not the code. Appendix I, genetic testing code modifiers. So special modifiers for genetic test. So they help to explain the test method, repeat testing or interpretation. So this Appendix I, it is important in molecular pathology coding. Appendix J, electrodiagnostic medicine listing of sensory motor and mixed nerves. So this consists of the list sensory motor and mixed nerves. So they are used in EMG and also nerve condition studies. So Appendix J, it helps to select the correct nerve code. Appendix K, products pending FDA approval. So temporary codes for products which are not yet FDA approved are listed under Appendix K. So these are used mainly for tracking as well as reporting. And next is Appendix L, vascular families. So this Appendix L, these are the group of vascular procedures by arterial families. So they are very helpful in angiography and interventional coding. So they also prevent the duplicate billing. Appendix M, renumbered CPT codes crosswalk. So they show the old code generated into a new code. So this is useful when codes are renumbered and also reading old medical records. And why are these appendices important? So because medicine is changing, for example, telehealth, AI and genetics. So CPT added new appendices to explain these services. So they also help to coders to bill correctly for modern health care. So next appendix is Appendix N, the summary of resequenced CPT codes. So some CPT codes, they are moved to a new place, but they are not changed. So the code number, it stays the same, but only position changes. So this appendix lists those codes. For example, the purpose of Appendix N is it helps the users to find the codes easily and to avoid the confusion. Appendix O, multi-analyte assays with algorithmic analysis and proprietary laboratory analysis. So this is used for advanced lab test. So this test, they analyze the multiple markers, they use the computer algorithms, they are often proprietary, nothing but company owned. So what is the example? Cancer risk test using many genes plus software. So this is important for molecular and genetic testing. Next is Appendix P, audio, video, telemedicine CPT codes. So this lists the CPT codes which are allowed for real-time video visits. So patient and doctor see and talk to each other lively. For example, like video consultation and virtual follow-up. So this must be synchronous, this must be live but not recorded. Appendix Q, severe acute respiratory syndrome coronavirus 2. So SARS-CoV-2, coronavirus disease, COVID-19 vaccines. So Appendix Q, it lists the CPT codes for COVID-19 vaccines for vaccine administration. So they are created during the COVID-19 pandemic and they're also updated as new vaccines were introduced. And next is Appendix R, Digital Medicine Services Taxonomy. So they explain the digital healthcare services. They include remote monitoring, digital therapeutics, and app-based care. So Appendix R, it helps to classify technology-based medical care. Appendix S, Artificial Intelligence Taxonomy for Medical Services and Procedures. So it explains how AI is used in medical services. So AI may analyze the images, assist the diagnosis, and support the clinical decisions. So this appendix does not give the codes. It always explains how AI fits into CPT services. Next appendix is Appendix T, audio only telemedicine CPT codes. So it lists the codes for telephone only services. So this is used when there is no audio, there is no video and there is only voice call. For example, doctor consults patient by phone. So still it must be live, the real time services. So this is about the appendixes. So this is for today's session. I hope this session has helped you. So in the next session, you will be learning about the modifiers and the types of modifiers in brief description which are used in CPT. So how modifiers are used, what are the use of modifiers, what does it mean in CPT? You are going to learn in the next session. Thank you.